A skin infection caused by the Varicella Zoster virus, which leads to rash and blisters on the whole skin of the body, is known as chickenpox. Every person adopts that infection mostly in childhood, but it could be in adults. It's most contagious. It affects people quickly through bodily fluids or touch. It's not a complicated disease, but chickenpox affects people with other diseases like HIV, which have more chances of causing complications such as pneumonia, dehydration, and others. Chickenpox is treated by vaccination. The first vaccine was discovered in 1995. In that era, chickenpox cases reached a lower level due to vaccination. Let's search into the video to discuss all the causes, symptoms, diagnoses, treatments, and prevention of this infection. What is meant by chickenpox? An infection of the skin causes itching and a rash. This is caused by a virus known as Varicella Zoster. Children have a higher chance of getting this disease. It is the most contagious infection. 90% of people around the affected person can adopt it. But if someone gets it once in life, he becomes vulnerable to it. Chickenpox mostly happens at the age of 10. Children catch this infection mainly in the winter or spring, between March and May. How many stages are there of chickenpox? Chickenpox changes the affected person's skin to a whole rash. With this rash, we see 3 stages of chickenpox. In stage 1, the rash appears red and bumpy, known as papules, but lasts up to a few days. In the second stage, these rashes are filled up by fluid called blisters of cysts, and after 2 days, these blisters burst. In the last stage, the blisters crust and scab over. This stage also lasts up to just a few days. Although the rash disappears after these 3 stages, chickenpox remains because the new bumps form and the old recover simultaneously. It means the affected person faces bumps, blisters, and scabs at a time. Sometimes, these rashes affect the whole body, and blisters can form in the eyes and throat. This rash or blisters may appear in the vagina, uterus, or anus as well. What is the exact cause of chickenpox? The leading cause of chickenpox is a virus known as Varicella Zoster. As we know, virus infection spreads quickly. That's why it's a contagious disease that can quickly transfer from one person to another through coughing, sneezing, or touching. The Zoster virus becomes dormant in the nervous system of the affected person for their whole life. But sometimes lately, at an older age, this virus causes shingles. What are the symptoms a chickenpox-affected person indicates? The rash caused by the Varicella Zoster virus usually lasts from 10 to 21 days. The rash mostly lasts up to 5 to 10 days. But the other symptoms, which include fever, appetite loss, severe headache, and dizziness, appear 2 days before the rash appears. How is chickenpox diagnosed? Chickenpox can be diagnosed by a doctor just by looking at the rashes. If a child has chickenpox, call the doctor. He will recommend some medicine to help the body recover from the itching. Sometimes, doctors may recommend lab tests or blood tests, including tissue studies of the samples. How chickenpox could be treated? As chickenpox happens due to the virus, antibiotics can't heal the infection. Avoid taking them. But in some cases, bacteria infect the sore, and the doctor recommends antibiotics at that time. Usually, chickenpox recovers by itself, but for people at risk of complications, consult doctors can suggest some antiviral medicines. However, these medications depend upon the age of the person, their health conditions, how they are infected, and the time to treatment. Chickenpox usually happens in childhood, but for some people, it could happen at an older age. Those not affected by this infection at an early age must get the vaccine. Due to vaccination, chickenpox is less common than in the early 1990s. Chickenpox could be prevented. People can prevent chickenpox by getting vaccinated. And if they get this infection, their symptoms are usually mild. Children should get the first shot of the chickenpox vaccine in 12 to 15 months, and the second booster shot between 4 and 6 years. But remember, those who get chickenpox do not need the vaccine. However, a pregnant woman should avoid taking the vaccine. What are the prescriptions to avoid severe chickenpox? Here are some tips to get relief from the itching of chickenpox. Give your child a bath with lukewarm water every 3 to 4 hours within the first few days. Do not rub the body. Use calamine lotion on itchy skin. Use pain-relieving creams. Put gloves on children's hands to avoid scratching during sleep. Regularly trim the fingernails of children. Serve your children with soft blended foods. Are there any complications associated with chickenpox? A person vaccinated against chicken has a rare chance of getting any complications of chickenpox. Not only that, but the person who got chickenpox one time in his life has no chance of getting back any symptoms associated with chickenpox. However, some people have an opportunity to adopt the complications of this infection. These include infants, adults, adolescents, pregnant women, people with weak immunity, and people already facing another disease like leukemia, HIV chemotherapy, organ transplant, or cancer. The complications are usually pneumonia, dehydration, issues with blood clots, and Reye's syndrome. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.